Hello, I am Dr. Shoaib Padaria, and today we will be discussing sclerotherapy, the chemical method of treatment of varicose veins. We all know that varicose veins is a very common condition all over the world. 1 in 5 adults have some degree of varicose veins. You'll be surprised to know that almost 25% of all women and 15% of all men have some degree of varicose veins or the other in their life. Now, varicose veins can be of different types. The most common which are seen are the spider veins and the reticular veins. Spider veins are tiny veins, usually less than 1 millimeter in diameter, commonly found on the thighs, the legs, and the ankle areas. In most cases, they cause no problem except being a cosmetic issue. However, in some patients, they may be responsible for pain, burning, or itching. Slightly larger veins, between 1 to 3 millimeters in diameter, are called reticular veins, and these usually feed into the spider veins. As you can see from this picture here, the tiny little veins which are there in the skin are the spider veins, and the larger greenish structures are the reticular veins, and they are all connected to the underlying feeder veins which are below the skin. So what is sclerotherapy? Sclerotherapy is a technique whereby we inject a chemical solution into these veins, and this chemical selectively targets and damages the inner lining of the vein, which is called the intima. It leads to a spasm of the vein, eventual fibrosis, and finally closure of the vein. The commonly used sclerosant chemicals are sodium tetrahedral sulfate or STS, polidocanol, or you can even use a high concentration of glucose or dextrose greater than 25%. And this chemical solution is injected by very tiny needles into the veins. Now, when you're treating spider veins, you use a very thin needle between 30 to 30 kg diameter, very tiny, and you inject a very small amount of liquid sclerosant into these veins. You must realize, however, that multiple treatments are usually required, but these treatments are very effective. They reduce symptoms in more than 85% of patients and definitely improve the quality of life. Here you will see the results of liquid sclerotherapy result. This is a patient with multiple spider and reticular veins on the backside of the thighs before treatment, and then after treatment you'll see at the end of 6 weeks the results show a good resolution of the varicose veins. When you have slightly larger veins, then you can use a technique called foam sclerotherapy. This is a technique whereby the sclerosant liquid is converted into a thick, viscous foam by mixing it up with air or carbon dioxide. This foam is then injected into the vein, and because it stays for a longer period of time in the vein, it is more effective than liquid injection. We basically use for treating slightly larger veins. Sometimes it's difficult to visualize the veins, especially in dark-skinned individuals. In such cases, you can use a special trans-illumination light to visualize the vein and then inject directly into this vein either the liquid sclerosant or the foam sclerosant. Here is a technique whereby we can inject a sclerosant liquid through a scalp vein. As you can see, the scalp vein is being introduced into the tinier veins. As soon as the foam is injected, the color of the vein changes from a greenish to a pinkish color because the blood from the vein has been displaced, and at the end of the procedure you see the veins have fully collapsed. At the end of 4 to 6 weeks, these veins almost totally disappear. Here is a small video which demonstrates how we actually treat these varicose veins with foam sclerosant. A tiny needle, as I said earlier, is put into these veins, and we'll visualize the backflow of blood into this cannula. Then the foam sclerosant is made by mixing the sclerosant liquid with air, and through this needle the sclerosant liquid is then injected, foam is injected into the vein. As you can see, the color of the vein is changing because the blood is being displaced. This foam is then gently displaced upwards into the upper veins, thereby effectively closing off the entire veins in these areas. The procedure is then repeated for the other veins of the leg. If you have larger veins like these, then you can put a tiny little catheter, which is a plastic tube within the vein, through a needle, and then directly inject the foam sclerosant, and on table itself you see the veins effectively collapse. Here are the results of treatment after sclerotherapy. Again, a patient with multiple veins in the backside of the thigh and the legs, and 6 weeks later, you see a good result with resolution of the varicose veins. So finally, to conclude, what are the points to remember about sclerotherapy? Both liquid and foam sclerotherapy are effective methods of closing small spider and reticular veins. In some cases, multiple procedures may be required at time intervals to close the veins. In most cases, however, the symptoms associated with spider veins are relieved. You must remember this is not a curative procedure, as spider veins are known to recur either in the same place or elsewhere in the legs. Sclerotherapy can be sometimes used to treat larger veins. However, it has been proven that for large veins, it's an inferior method of treatment as compared to laser therapy. For further details, do visit our website www.varicose.in. Thank you for your attention.